Just before we get going, just a couple of house rules or just information. So this session today is being recorded and closed captions are available. You should see them at the bottom of the screen. The recording should be shared shortly after the session's finished in the next few days and will be available on Bond's resource page as well as Able Child Africa's website. A big thank you to Bond today for hosting this discussion. And yes, I hope it's a really good one. Over to you, Ant.
Welcome to Momentum. We aim to be as accessible as possible. We will endeavor to speak slowly, but without any comment that may be anything repeated or diminishing human is about accessible for you. This is the peak of a month that can develop. Version of this event will be made available if you will follow it when you're on perfection. I am Anthony Boulder at the film Communication Position at Able Fire Bucket and your festival. My co-host is Annie Ford, who is the senior program officer at Able Fire Bucket. In your first panel today, we will be discussing what the social perception of private marketing is having people with disabilities as well as our local partners. Our conversation today will be about how people with disabilities and their partners have more material support they can need during the COVID-19 pandemic. What further action can be taken to improve workplace functions and more disability users. I'm now to develop a major panel that comes into the brief info from Simon.
Simon, if you could introduce yourself. Simon, if you can hear me, would you like to introduce yourself?
Okay, fine. I'm Simon Munde. I am the acting executive director at Federation of Disability Organizations in Malawi, and in short, we call it FEDOMA. FEDOMA basically is an umbrella organization of 12 organizations of persons with disabilities in the country. I think that's enough.
Simon, can you introduce yourself, please?
Hello. Hi, do I introduce myself?
Yeah.
Oh, thank you so much. My name is Sharon Dungu. I work at ANDI, Action Network for the Disabled, as the project coordinator, and for a project called Ready Steady Go that ensures children with disabilities access early childhood education. And apart from that, I'm in other programs, all focusing on parents and children with disabilities. Thank you.
Women.
Thanks, and yeah, hi everyone. My name is Jimmy Innes. I'm the Chief Executive Officer for AD International, Action on Disability and Development, and it's a pleasure to be here with you all today. Thank you.
Yeah, thank you. And hi, everyone. It's also a pleasure to be here. So I'm Nick Corby. I'm a director of Impel Consultancy, a group focused on disability inclusive development. I should also say I wear a second hat as a co-coordinator of the IDDC's Inclusive Health Task Group, but it's as a director of Impel I'm here today.
Thank you very much.
And so before we move on, you'll see at the bottom of your screens that there's a button with Q&A, and we would really welcome you today to use that function and to ask questions that you have, and to really join in on the discussions that we have today. And we'll be asking a series of questions to the panel, but we really want to hear the voices of other people and hear your questions as well. Just to introduce myself, I'm Alice Ford from Able Child Africa. I'm the Senior Programs Officer, and I'll be co-hosting with Ant today. Over to you, Ant.
First question. What are some of the biggest barriers experienced by people with disabilities and their families when accessing health services during COVID-19?
Okay, I go first. I go first, right?
Yeah, Sharon.
Yeah, this is Sharon.
Yeah.
Well, here, during the COVID-19 period, I think it was the most difficult period for parents of children with disabilities and children with disabilities themselves because of so many reasons. We had an engagement during that period with parents, and most of the things that were coming up were in terms of health services access. And like here in Kenya, there were regulations every day, maybe just to curb down the COVID-19 spread. So there were cessations, there were lockdowns, the schools were closed. And now these kids, on weekly basis, there are kids who are on therapy, and those are some of the services that they missed. And therapy services was not enlisted as one of the key service. So there were no access to hospitals. So because now you are supposed to access the hospital only if you have like with COVID-19 related issues, because, and it also happened when the COVID-19 came in, the doctors were on strike for the longest period in Kenya for the first time. For like 3 months or so or more, they were on strike. So even if you access a private hospital, there are no doctors because the public facility doctors had influenced even the private hospital doctors. And then now the other thing is that there are kids with disabilities who are on medication. Some of these medications, like the drugs, are imported, and parents were not able to access these drugs. Some were going, if you are a bit well off, some were going as far as using whatever means to have your drug brought from maybe our neighboring country, Uganda. This was again shared during one of the parent support group meetings. And the other thing, due to like loss of jobs for the parents during that period, and also maybe the businesses were also, they were not doing well at all. They were, due to lockdowns, and people were unable to like bring in their goods for sale. Parents were badly affected because most of these parents are also not in employment, but in businesses. So, and the businesses were affected as well. So they were not able to like afford medical care for their children with disabilities. Yeah, just to mention, but a few. Thank you.
Bill about our pandemic from her as any channel comment on any aspect of that question.
Hi, Anthony. It's Jimmy here from AD.
Yeah.
I just wanted to pick up on Sharon's last point about the economic barriers and how that's something that we've found in our work as well. As ADG, we work in 5 countries, 3 in Africa, 2 in South Asia. And we did some research last year. I'll talk about it a bit more as well later. But one of the things we found in this research, we spoke to members of OPGs or DPOs around the country, mainly from the district and grassroots level, to find out the impact of COVID-19 on their lives. And one of the key obviously it's true, points that came back through in the research findings was the impact, the economic impact at the family level. And basically across the board, we did this research in 3 countries, in Uganda, in Bangladesh, and in Cambodia. And across the board, the DPO members who we interviewed were reporting a 65%, 70% loss in earnings since the pandemic had started. Now that's significant, massively significant. And when healthcare provision in many countries is at cost, it's an enormous immediate barrier to accessing healthcare provision for children with disabilities and their families.
And it's Nick here, if I can jump in, if that's okay.
Yeah.
I mean, I completely agree about the finances point, and I was going to say exactly that. But just to build on what's being said as well, is even the practical elements around transport, for example, when public transport severely restricted or halted entirely, when private cars aren't allowed on the road for various lockdown restrictions just to get access to health facilities and hospitals. Again, that's proved a huge barrier for many families. I know some programs have found ways around this, and we'll talk about that later, I'm sure, but it's worth putting that on the table too, that it's some of those very practical elements have been missing.
Can also come in. Like in our situation, it was also quite a big challenge, more especially when we look at access to healthy services by children with disabilities. It seems the government had gone more into issues of COVID-19 interventions, and this actually affected service delivery to even children with disabilities. I'll talk of situations of those children with some psychosocial disabilities like mental disability, that they would need the kind of maybe drugs for disability management, issues of sunscreen lotion. I would say that our hospitals had like even run dry in terms of sunscreen lotions, epilepsy drugs, and it was quite a very serious challenge that the only thing you could access them, you have to go to a drug store where the cost for such kind of medicinal kind of substance are even very, very expensive and bearable for an average Malawian, and it became quite a very serious challenge. What it meant is that for those with maybe mental disabilities, they would have maybe frequent episodes and stuff like that. And it was quite a serious challenge. And even in terms of physiotherapy, as Sharon had given us the Kenyan experience, it was also quite a very serious challenge. And that was aggravated by the transport challenges because the cost of transport had gone up because the government regulations were to the effect that it reduced the capacity for most of the public service vehicles. It had gone to almost half, and for the service providers, they had to increase their fares. So the cost of life had even become much more. Thank you.
Yeah, if I can just add something on that, and yeah, still on health services access. He has mentioned about the cost of drugs, and this reminded me when a parent was sharing, and she said she had to like buy the same drug that she uses at a cost of 3 times higher of what she used to buy the drugs normally. So the drug costed her like 10K, which was not very available during that time. So it was really bad. And also to report that so many kids died due to convulsions, just like that. Even during some of our engagements with parents, we had a session like today, tomorrow, like half of the parents are not there. They went to support one of them whose child had passed on. And then also the issue of the National Hospital Insurance Fund. When COVID came in and the government decided that it's not going to support the COVID-19, so everything was just like scratched off. So even if you have any other conditions, you can still not access health services using the National Hospital Insurance Fund. So that became even worse for these parents. Yeah, thank you.
I think Nick had a point of comment on.
Yeah, you've opened up a big issue here. I suspect lots more ideas might keep coming to us. But I mean, I think also the attitudinal barriers, I think, have really come to the fore during the COVID-19. I mean, it's been clear to see how it's not just children with disabilities, but almost all persons with disabilities have been othered during this. How there's some of the health messages have highlighted perhaps the vulnerability to infection of COVID-19, and that's led on to, it kind of exacerbated some of the stigma that's been there. Some of the worst examples I've seen are here in the UK, where there's do not resuscitate notices being placed on, blanketly placed on some persons with disabilities. And so their entire access to health services and hospitals have been denied them from the offset. The minute they fall ill, they stay in their care homes or wherever they might be and unable to access the doctors. In other circumstances, they may not have that notice placed on them, but there are cases where doctors have refused to come to them to provide treatment. So some of those attitudinal barriers, sadly, have really compounded themselves. I worry slightly how we might undo that in the future.
And just to add on that, I totally agree with that, Nick, and it's such a massive step backwards, such a horrible step backwards after years and decades of progress on disability rights and inclusion. And here we are, this pandemic is in danger of losing so much ground for everything that has been so hard fought and hard won over many, many years. And I'm very worried about that aspect as well.
Yeah, I would also add, as you're putting it, the aspect of the negative attitudes. Even most of the children, they would sometimes the kind of the social interactions they've been having were quite helpful to most of the children with disabilities. And with the pandemic, even for a child with a disability to have a colleague who would be able to guide them around in different places, it's been quite a challenge, even in terms of play, enjoying that right to play. So the kind of support that has always been there, previously provided for by peers, it's not been an easy thing in this kind of an environment.
For we move on to the second session, what happened to Harvard Sciences Paloma during the pandemic and subsequent lockdown? Simon and Sharon are there. Yeah, so
Simon, do you want to answer that one first, and I'll add in after?
Okay, this is the second one to do with the challenges in our work. Yeah. Okay. It's really been a very serious challenge, more especially in our context. We've been talking of using the working from home approach. That's what has been mostly used. But the biggest challenge with it is that the delivery is an institution that you would really want to be as productive. When you're at home, it's been quite a very serious challenge, more especially in our environment that you may not even have a corner or an office at home. It hasn't been an easy thing. And where you also talk of extended families, sometimes you'd work in a way that you are scrambling for the sitting room, with the kids, and it hasn't been an easy thing. So even from your colleagues at work, you expect that they will deliver as much, but it's not working out in that kind of a way, because you are basically at home where kids are also running up and down, throwing cautions on each other and things like those. And you would also want to respect their rights by not disturbing them. And another challenge that we've been experiencing is the cost for internet bundles has gone up quite a lot, because you have to get in and out of a virtual meeting every now and then, and you have to manage that kind of a cost for your members of staff at the office, for your own self, interacting with different people, and at the same time as in umbrella organization for OPDs, we always have to make sure we network. And the levels of financial capacity for our OPDs, they are different levels. Others are high up there, others are quite low. Their budget for their office is very small, sometimes even surviving on membership fee, no actual funding for their offices. So for them even to manage virtual meetings, online meetings, it hasn't been easy. So that has actually disturbed our coordinating and networking role within the network. It's been quite disturbed. We haven't conducted meetings for quite some time. The time that maybe it's lighting up a little, that's when you organize a meeting that you can sit down as a network and discuss on how you can strategize on the advocacy issues, to advance them, to take them to relevant authorities. And some other times, even some of the representatives would decide not even to come. And at some other time, you'd hear that maybe so and so has passed on from a particular affiliate organization, and still more, you have to provide the kind of moral support with the movement or the particular OPD that has been bereaved. But you can't even sometimes go to meet them. And in such kind of situations, you would find that they would break for maybe 3 weeks without physically interacting with their colleagues. So it has really been affecting our work seriously. And some other times you have to just take the same virtual approach, but with emails, just exchanging emails, you're expecting comments, they'll make comments, and for you to come up with a final document that you can even submit to relevant authorities, it's maybe 2-3 weeks later, because people are not as productive as they used to be. Thank you.
Yeah, Simon, it's Jimmy here, and I think I echo a lot of your points, and you know, I hear what you're saying. You know, from a personal point of view, we've all had our own challenges to deal with in our own lockdowns, in our own context, or wherever we are. You know, I'm sitting here in a box room. This has been my office for the last year, literally for a year continuously. And you know, the longer these lockdowns have gone on, and here in the UK, we've had homeschooling or stay-at-home orders. We've had a lot of restrictions on what we would consider to be a normal life under any other period of our lifetimes. And it gets harder, doesn't it? It doesn't get any easier. It gets harder and harder. For us as an organization, we're an NGO. We work especially with and through OPD partners in Africa and Asia. And we've tried so hard, really hard in the last year to galvanize our work, to really focus everything we do to support a disability inclusive COVID-19 response by working and supporting our OPD partners. And I'm really proud of the work we've done, but I'm also really aware that it's nowhere near enough. Yeah. And I think that the longer this pandemic goes on, and we're only 1 year into this pandemic, how many more years of this have we got to get through? My worry is as we go longer through it, the lack of extra support to organizations like Simon's Fredoma, who can't even afford internet bundles to be able to run a Zoom meeting. Yeah, we need to be able to support the Fredomas of this world, who represent their constituents, their members, the persons with disabilities down to the grassroots level in Malawi. If we're going to have impact on a disability inclusive COVID-19 response, then we have to empower and capacitate and fund organizations like Fredoma. And unfortunately, until now, the world hasn't been able to do that. And that to me is the biggest challenge that we face for the pandemic era ahead of us, is finding ways to leverage the support and the resources that are needed where they are needed. And that starts with OPDs for me.
Fun maybe we should be involved. Mambo Fair, how can we improve access to healthcare for people with disabilities during the pandemic? That would in particular.
Yeah, let me start the response to that one. I suspect this will generate a huge amount of conversation. There's a lot of ground to cover here. But I guess first of all, there's a few ways you could look at it, isn't there, about what services are we talking about? Mainstream health services, impairment specific health services and care, or is it COVID-19 specific stuff? There's some different answers I can give to all of those. I suspect the best way I can answer the question really is to give some examples that I've seen from other organizations around how they've helped to improve access. I mean, I think we're all very familiar with the efforts made around accessible information through OPDs, for example, making sure that's shared with their cohorts and beneficiaries. But there's been some really interesting bits as well. I know Sense International, for example, in Uganda, they had a permission sticker that they obtained that they put in their vehicle so that they could transport ill children to hospital when there was no public transport at a time when transport on the road really wasn't allowed. It was an exception to the rule, which was fantastic. Similarly, I know Senses in India and Bangladesh, they provided direct support in getting medication actually to the children at their homes using local networks and local contacts so that they don't have to leave their homes under COVID-19 restrictions. I saw a question in the chat as well around the ability to give cash to beneficiaries, and there was an Aga Khan Foundation, one where they gave cash transfers via mobile money, and recognizing that the hygiene packages or the food baskets that were being handed out didn't cover all the needs. For example, the cost of medicines that we've spoken around. So some of those cash transfers were designed specifically and targeted specifically towards those who needed medicines. Some of the impairment specific stuff, I'm always reminded as well, there's a CBM India program, I think, where they've got a community-based vision center for eye tests and to hand out glasses still. They found a way to do that under COVID-19 restrictions and in a COVID-19 safe way. So there's lots of nice green shoots happening out there around how to improve access to healthcare. Frankly, I'm very conscious of the barriers that we've still got to face moving forward, but that's a whole other conversation. Let me pause and let others come in if they want to.
Hello. Yes, so I think on this, from Kenya, what we did, we came up together, groups were formed, all groups that caters for children with disabilities, to try and advocate for access to healthcare services for children with disabilities, focusing so much on the National Hospital Insurance Fund, which does not cater for these services that are very key and essential for children with disabilities. So that there are good progress on that. And also, in regards to COVID-19, and there were, sorry, in regards to COVID-19, there were also therapy services online that were offered by these organizations, just sessions for parents to access, at least because now these parents were not prepared for a rainy day. These are the parents who drop their kids to therapy centers and just leave them to the OTs to perform their things, and then you just pick your kid, go back home, or maybe drop them to school. So they were not prepared. So we identified a need to like prepare these parents in case of we were not prepared for the pandemic, so we don't know what else might come up. So there was need to equip these parents with this kind of knowledge so that they're able to offer these same services to their kids. And what else? Yeah. We also partnered with KICD, that is Kenya Curriculum for Development, Institute Development. So that there were sessions on one of the channels that is government owned to train these parents, and it's free to air so that they are able to access some of these services, including the education services. It was something that we advocated for, because initially when the government started offering such services to maybe for other kids, children with disabilities were left out. And you remember even the regular updates and stuff were not very friendly to these kids. So they were not understanding what is happening, what is being said. So we also had a way of breaking this communication down to these kids. And really, parents had really hard time doing this. So communication around COVID-19 on healthcare matters were also a challenge to access. And this is what like some of us did in partnership, because we realized this is not just something that you can go on advocating by yourself. It needed like a force. Yeah, thank you.
Can I come in?
Oh yes, Simon, go.
Yeah, basically, the healthy service delivery to children with disabilities has been compromised indeed. And this level of compromise is coming because, one, maybe because of the unpreparedness that maybe like in our context, our healthy system has been. And to an extent that some other times they've used some of the health workers that maybe were supposed to be in the medical rehab section, some of them that may have been in the psychosocial section of the hospitals. They've been even taken to some of the treatment centers, the COVID-19 treatment centers. And that kind of unpreparedness is what has to be addressed in this particular scenario. That maybe some of the staff, the healthy workers that had been taken to support in the COVID-19 treatment centers should be brought back to their centers, to their sections. In so doing, we expect that healthy service delivery to children with disabilities will be restored. At the same time, I think the government, being the main duty bearer in health service provision, has to understand their obligation. And that's where now I think we come in as advocates to still engage the government more, to understand that they also have an obligation which they had maybe shunned at some other time because of the pandemic. They have to go back to their responsibility such that even when we're talking of sunscreen lotions, we're talking of, because just imagine a child with albinism who has been left out and they grow without provision of sunscreen lotion. Definitely we're exposing them to even other dangers, other hazards like cancer. So if we're leaving a child like that at that early age without providing for them necessarily in support like sunscreen lotions, like mental health drugs, epilepsy drugs. If we're leaving them like that at that early age, definitely we are compromising even their future, be it when they will be at 6, at 10, at 15. So it's important that the government must still more provide for resources for the procurement of such kind of important healthy drugs. So basically, we still have to go back to government to make sure that they have to understand their responsibility beyond the COVID-19 pandemic. Thank you.
Thank you. If we can go to one of the questions that we've had from people listening in, we've got a question here from Julia. She says, thank you for all this great panel. How have the different organizations of the members on the panel supported these families who have suffered a loss of income, especially when navigating stringent funders who do not necessarily always support giving cash to beneficiaries directly?
So I can answer that from our perspective. It's Jimmy here from AD. So yeah, I mean, it's really interesting. We're a rights-based organization. We spend all our time fighting and advocating for the rights of persons with disabilities and for global disability inclusion. That's what we do, and that's a long advocacy ask. Yeah, it's a continuum. It takes time. We never have an end to that process. But the moment the pandemic struck, we also found ourselves suddenly overnight becoming a food package deliverer, yeah, an essential medicine deliverer, in a way that we'd never done that kind of work before. And we found with our existing donors, our existing institutional donors, we found a lot of acceptance, understanding to be able to refocus our projects, whether that's in inclusive education or livelihoods or whatever, but to focus it specifically on responding to the immediate crisis. And that included with the provision of foodstuffs and essential items and essential medicines. But that's all well and good, but we're a small organization in the grand scheme of things. And we were able to do that in some places, but by no means in any enormous significant way. And the challenge I think we found is, well, the donors weren't all fast to pivot themselves. It took time to have these conversations with our institutional donors to be able to refocus our work on supporting the provision of Essentials Prize. And then we found as we moved through the course of 2020 that there wasn't actually enough new funding streams coming on board to support that kind of work. And that's been a disappointment for all of our efforts in terms of the ability to respond effectively and in a widespread manner. The world, as I was saying before, has not stepped up with regards to providing enough resources and tools for people like us and people like all of us on this call to respond appropriately. So yeah, we, in our own way, we responded on essential health, on essential supplies and provision, but it wasn't enough.
I can as well respond to that. As I said, as an advocacy organization, our interest is to promote disability inclusion, disability rights. And one thing that we have done is to talk to the government. The government came up with what is known as the urban cash transfer. That is targeting the ultra poor households within the urban sector. And we actually, this program is targeting, is quite mainstream, and our interest has been that the government must make sure that it includes persons with disabilities and households of children with disabilities as they are actually rolling out the urban cash transfer. What we've noted is that as the program started, it seems still more that persons with disabilities and households of children with disabilities have been left out. There are some that have been included, but still more we feel that the ones that were quite deserving, that were quite needed, a good percentage has also been left out. And that is a very big concern for us. And as of now, we are trying to bang heads amongst ourselves in the movement to decide as to what should be the next move that we should take. We've also advocated to other international NGOs that are involved in emergency response. Some of them are giving out foodstuffs. Some of them are giving out cash, like the Red Cross. So we're talking to them to make sure they include households of children with disabilities, so that they also taken out of the economic challenges that are there.
Yeah, I think for Andy in Kenya, so yeah, as everyone has said, switching from advocacy to humanitarian response. So now, a few funders were flexible, some were very strict, some ended up like stopping the project like completely until when COVID comes to an end, up to date. But as Andy, we partnered with other organizations, like for example, we partnered with World Food Program, the UN agency, who contributed amongst themselves, the staff themselves, to make sure that they feed families of children with disabilities in Kibera, and also the Visa Oshwal. We also partnered with another organization called Nondo, and particularly to like translate this Ministry of Health messages into a communication that is accessible for all, like translating everything that is being said and also channeling them into other radio stations in the language that is best understood by them. Because now most of the time the updates were in Swahili and in English, but the people at the ground, maybe the ones who only understands vernacular and stuff, could not access these messages. So we made sure that they were accessible for them. Yeah, thank you.
All right, so we move on to question 4. So first and foremost, how CSOs and BPOs work better together to support each other. That was for me. Sorry, family.
Well, I think I go first. For the first time in history, I've seen CSOs and DPOs and other organizations coming together to support each other, just for the benefit of that child with disability. Not everyone pulling the strings on their side because of the competition we've always had in maybe getting funding from this funder and the other. So this time round, they were acting together. Any support coming from wherever, we were working as a network. And I think that is the best way to go, because even going forward in our advocacy work, then I think a lot can be achieved through working together. Yeah, thank you.
Can I come in?
Yes.
I just wanted to also add to that. You know, I think ever since the pandemic came, as FEDOMA, we've never had any funding for to address issues of COVID-19. But basically, we've ridden on the back of other organizations, and at some other time, take advantage of our networks. Our networks, maybe within the media fraternity, we've made use of the media quite a lot. And through that, we are able to realize lots of results. And riding on the back of others, we've also done that, both in the mainstream civil society and even in the disability fraternity. I'll give an example of a situation that okay, we've been able even to interact with the Presidential Task Force on COVID-19. We've raised so many issues with them. And at the same time, within the disability movement, one of our affiliate organizations, we call it Visual Hearing Impairment Membership Association, which is otherwise known as Deafblind Malawi. They have been able to work with us because they had resources, they had funding for COVID-19. They were working with us and even bringing together all the OPDs, discussing various issues. Through that, we've been able to make a lot of input to the national COVID-19 response plan, which initially ran from around, I think, is it May last year to December last year? And it expired that time. And the review process, it did not actually include us as a disability sector in the country. But through this kind of an arrangement, working with the Deafblind Malawi, we managed to convene all the OPDs under FEDOMA with support from Deafblind Malawi, and we made a lot of input to it. And in some of the meetings, we even brought in the co-chair of the Presidential Task Force on COVID-19. And knowing how much this particular OPD contributed to issues of disability inclusive COVID-19 prevention, interventions and whatever, we as FEDOMA, we were privileged to have hosted the African Disability Alliance COVID-19 consultative workshop. It was a virtual one, and we made several presentations, but on issues of the work of NGOs and OPDs, we had to bring in this particular affiliate organization to make a presentation of how they had worked with all the OPDs through FEDOMA. So I'm just giving this as one of the case studies that I would say that shows the working togetherness, the togetherness that is there amongst the OPDs, and even us taking advantage of other mainstream organizations. Thank you very much.
Hi, and can I come in as well on this one? I wanted to pick up on something that Sharon said at the beginning there, you know, how she's never seen such a level of coordination between CSOs and OPDs in this period. And I concur with that. You know, I think that there's been some great initiatives which have closed the gap which sometimes existed between OPDs and CSOs. And that's really encouraging to see. You know, look at the international level. From the moment the pandemic was declared, the International Disability Alliance, IDA, was very fast and effective to begin to coordinate the movement in a collective response, and established a great working partnership which continues till now with IDDC, the International Disability Development Consortium, of which AD is a member. Nick mentioned earlier that he's one of the co-chairs of a task group for the IDDC. And the IDDC is not exclusively, but mainly comprised of international NGOs working in the field of disability inclusion. So that became a great international partnership between the movement and the civil society to have joint advocacy. And this year, IDA and IDDC are advocating for equitable access to vaccines for persons with disabilities. And it's going to, as we all know, that's going to be a critical lobbying point for all of us in our work this year and beyond. So at that international level, we've seen that. At the country level, we as AD have seen that as well. For example, in Bangladesh, there's a coalition of NGOs and DPOs to lobby and advocate on government. They've signed joint statements, joint position papers. They've also worked through the media in the way that Simon's talking about there. And we're seeing similar things in Tanzania. We tried to set up a coordination mechanism between the DPO movement and the NGOs who are working in disability inclusion to respond to COVID-19 in a coordinated way. And I think that's been really good work. Excellent to see. And, you know, it's like a lot of this, I always think about the CRPD, the Convention on the Rights of Persons with Disabilities, and General Comment number 7, which I love, which is all about the full and effective participation of persons with disabilities and organizations of persons with disabilities in efforts to address global disability rights and inclusion. And it's not rocket science, right? This is the principles of effective participation and effective collaboration. And I think one of the key things that we want to see more of is broadening this conversation. It's not just about NGOs like AD who already work in disability inclusion, but it's about brokering and creating those conversations between mainstream NGOs, mainstream organizations, and organizations of persons with disabilities. And the more we can foster those kind of partnerships, the more we can open up the space and the partnerships that exist in order to have a more collective and joined up response.
We're gonna have a brief right now to the everybody on this for the side 10 minutes.
Yeah, okay, so we'll join back in 10 minutes time. Great, see you soon. So I think we've got just about time for one more question. So Ant, back to you.
From what have been the key successes for independence that have protected and supported people with disabilities during the pandemic, and how will we for people with mental health specialist or vulnerable with disabilities are not left behind.
So I might just repeat that for Simon as we have just merged the question there.
Yeah.
So what have been the key successes for interventions that have protected and supported children with disabilities during the pandemic? And how do we ensure children with mental health issues or psychosocial disabilities are not left behind?
Well, if I may go first. So our key success during the pandemic period. So this came with, it challenged, the pandemic challenged us in the way we do things, and also created innovations within us on how to do other things other than the way we normally do things. So, well, as I had mentioned before, that we worked very closely with parents. And this is the time that we really wanted to have them much closer because of there's families that were even broken because of the pandemic and the burden that comes with children with disabilities. So apart from the media awareness that were increased, and also partnerships that were established through the mainstream media, we did parent support group trainings on home-based care for their children. This is something that we had not factored in before, but we thought anything that has to do with their children, then they need to be on the front line. Yeah, not just accessing services elsewhere, but also having an idea of how to go about it just in case they're not able to access those services. Then we can say increased partnership was a success for us, where we got in so many other CSOs that don't necessarily work with disability, but they were there to help out persons with disabilities as well as parents. And that is a plus because now going forward, they are on board and they also want to understand disability more. So that is a plus for us. And also working closely with parents of children with psychosocial issues, disabilities, and mental health.
Let's just wait a second to see if the connection comes back. No, I think not. So, Sharon, if you can.
There's so much on this, apart from evicted because they are not there.
So sorry, Sharon. I think we lost you at the end there, but maybe if we can come back to you later and hear the thoughts of anyone else. I don't know, Simon, you want to go next?
Hello? Hello?
Hi,
Hello?
Simon. Yes, we can hear you.
Okay, I wanted to say that basically we had also taken advantage of the the pandemic, so to say, more especially for some few households, because there's been a very strong tendency by some of the parents to even lock up their children. But with the situation that mobility was restricted, this time around, it was like now the within the households, there was also some pressure to say that children are within the house, a father, a mother, they are all within the house now. So that provided an opportunity for most of the parents and the siblings to have more interaction with even the children that were being locked up before. So because of that kind of pressure within the homesteads, even some other children that were not known before that they are part of the family that were being locked up were now being identified. We had one or two situations like that. So that's one key thing that much as the pandemic has been a problem, but it had also given us opportunity to identify other children with disabilities within the homestead. At the same time, in terms of what we can do to ensure children with psychosocial disabilities are not left behind, I think it's empowerment of the parents. Parents must embrace their role as key supporters to their children with psychosocial and mental disabilities. So we empower more of the parents and even the siblings that they must be able to play their rightful roles in providing even that kind of psychosocial support to their children or their sibling who has a psychosocial or a mental disability. I hope that will help quite a lot. And at the same time, we also need to make sure the community structures are also empowered, because some other times these children may not even enjoy the love from their parents or their siblings. But if these community structures are well empowered, they should be able to even blow a whistle at some other time when they see that these particular children are being exposed to any kind of danger. Thank you.
It's Nicky. If I can come in and add, if that's okay. I mean, I just want to maybe just build on maybe just the points really. I think it's very easy for us to identify the challenges. There are many, and I could gloss over them in the slightest. But I think there are some wins, I suppose, some successes from COVID-19 that have really started to emerge. I'm in a luxurious position where I get to work for civil society organizations and OPDs, but also work with governments and multilaterals. And I've seen two things start to emerge, which I'd like to think of successes for the future too. One is a much greater focus on psychosocial activity, psychosocial first aid, for example, mental health. I think COVID-19 has really brought home to a lot of people the challenges and how they need to really address this. The other piece I think I've really seen come through is a greater focus on inclusive safeguarding. There's, I think, a much stronger recognition that COVID-19 and contexts like this mean that children with disabilities are more susceptible, more at risk of safeguarding issues. And there's been a real push I've seen, not just in the civil society sector, but also at governments and donors, to really focus in on this and make sure the processes and procedures are far stronger than they were pre-COVID-19. Yeah, I think it's worth just putting those on a table, because I think it's worth celebrating, hopefully, the successes as we move forward too.
Well, thank you very much for that. We're moving toward the end of the time we have available today. But does anyone from the panel have any comment or something they want to say for finish?
Hi, Ant. It's Jimmy here from ADD. I think just from my side, it's how welcome it is to see this this series of webinars being set up by Able Child with the focus on the child. And I think that's such a great and refreshing perspective to see. And to be honest, since the pandemic was declared over a year ago now, this is one of the only child-specific fora that I've had the chance to participate on, either on the panel or as an attendee. And so it's a very welcome addition to the plethora of online meetings that we all attend every day. And I'm very pleased to see that there's a series of these addressing the perspectives and the needs and the experiences of children with disabilities during the pandemic. So well done, Ant and team, and I look forward to attending the ones coming up as well. Thank you.
Thanks, Jimmy. And I'd also like to add that we have been developing a series of inclusive, disability-inclusive child safeguarding guidelines, which we've engaged with Ad, Andy, and Simon from Fedoma. There is going to be a launch event, which will be our next Momentum event on the 28th of April. And so I really welcome you all to attend that event on the 28th. And so you can, anyone that isn't aware of the safeguarding guidelines that we've been developing together with Save the Children International, please do come along, and we look forward to seeing you there.
That's it about Vinda here in the bar for Momentum. So I would like to thank our panelists for the wonderful intention discussions. It's been fantastic, and also thank our audience for their time today. So thank you very much, and goodbye.
Thanks very much. And thank you to Sharon and Simon for your giving up your evenings as well. I know it's a bit later for you guys, so thank you. Thanks, everyone.
Thank you all.
You're very welcome. Bye-bye.